Friday's change in masking guidance from the Centers for Disease Control and Prevention comes as many states and cities across the U.S. are starting to, or already have, ease up on mask mandates. According to the new CDC metrics, about 70% of the U.S. population lives in a place where they no longer need to wear a mask to protect themselves and others. Their calculation is based on three variables: rates of new cases, new hospital admissions and hospital capacity. But infectious disease specialists surveyed by NPR say they're not ditching their masks just yet. Many still plan to wear them because they live in a part of the country where the coronavirus is still spreading widely, at least for the time being. When would they feel comfortable dining in, teaching and grocery shopping sans masks? They shared their personal risk calculations with NPR. The CDC's new emphasis on hospitalization rates is warranted, but that metric isn't necessarily the best guide when considering your individual risk, says Dr. David Dowdy, an epidemiologist at Johns Hopkins University. He and other experts still look at local infection rates when they weigh their personal precautions. Dowdy says he's vaccinated and boosted and feels well protected from hospitalization, but he's still trying to avoid catching COVID. "I just don't want to be out of work. I don't want to be spreading it to my family and making them have to miss work and school," he says. And so from that perspective, cases actually matter more than hospitalizations. Dr. Robert Wachter says he's waiting for daily case rates in his community to drop down to 10 cases per 100,000 people per day. "There's nothing magic about the number 10, says Wachter, chair of the Department of Medici. "If someone else prefers 15 or 20, that's fine. He's looking for a number that implies a lower amount of virus in the community." In California, where Wachter lives, the rates are currently around 24 per 100,000 people per day and falling. And he is starting to make exceptions to masking up when there is a big enough benefit, which for him includes eating at a restaurant indoors. The number of new cases per capita is also guiding Dr. Ali Khan, dean of the School of Public Health at the University of Nebraska, in deciding to mask or not. Khan would like to see about 5 to 10 cases per 100,000 people per day before going mask-free. "My desire was never to have individuals wearing masks forever, it was really to get levels of transmission in the community low enough so that we could be safe," he says.